Awesome. Well, we're live here at Health, not at Mars, but Vegas. I'm super excited. I'm the host of Planetary Health First, Mars Next. My name is Michael. I got
Jack from Translucent.
Yeah, and I got Vinay, Bonfire Analytics, and what we can only say but so much. But we got some super cool stuff here, and you guys are founder. That's why I'm so excited to have two founders moving healthcare forward. Jack, you want to just introduce yourself real quick?
Yeah, I'd love that. Thank you so much. So I'm Jack O'Hara. I'm the CEO, founder of Translucent. We're a redesign company. Before this, I led product and engineering at ChenMed, which is a large value-based care company in Miami. But I have a really big healthcare background, worked at health systems, provider groups, EHR companies, but I'm really happy to be here today.
Awesome, man. Vinay?
Yeah, absolutely. Yeah, thanks for having me, Michael. Excited for this. I'm Vinay. I'm the co-founder and CEO of a company called Bonfire Analytics. We're an AI-driven sales intelligence platform for health tech companies that sell to providers and payers. My background, I'm a biomedical engineer, worked at Stryker, and I pivoted to early growth stage digital health, where I actually led growth. So selling to providers like hospitals, health systems, found that it was really painful, and then joined forces with my co-founder, a good friend of mine from college, who had data science experience. And so that's how we started Bonfire together. So it's been an exciting journey.
Cool. Awesome. Well, I know this buzz of generative AI. Where do we want to start? I know before we were in the green room talking a little bit, Jack, Vinay, where do we want to get this conversation going?
Yeah, you want me to start or you want us to?
Feel free, Jack.
Okay. Yeah, so I've been looking into generative AI for the past couple of years, and it's been really interesting. And I see 5 main areas in healthcare that we could use this. So one is clinical care. So physicians, nurses, there's a ton of great companies out there. The second is patient-facing technology. So all the world of like health champions, I think is a really interesting area. The third is RevCycle. It's its own beast, ton of great companies. Fourth is clinical care operations. So you think your call center, scheduling. But the fifth that I'm really, really excited about is around SG&A, or healthcare corporate workforce. So that's your healthcare marketing, finance, IT, compliance, legal. But what's like really, really interesting about this area, everyone's talking about taking the $1 trillion admin spend out. 680 billion of it is actually in this SG&A spend. But what's even more interesting is 3.5x. The industry of healthcare spends 3.5x more than any other industry per revenue dollar on SG&A. And so there's just a ton of application in AI for that area. So
I would love to be the little skunk house in that little design house, like all the different things that are working through that. Yeah, that's awesome.
Absolutely.
Yeah, I know. It's an interesting theme in terms of AI and the different applications it has. And obviously, we're looking at the commercial adoption, right? So our mission is to accelerate the adoption of healthcare technology, like digital tools, therapeutics, devices. And so it's really interesting now where data has more liquidity, the opportunity for applying analytics in the commercial side. That's where we're kind of focused. So we use a mix of, medical claims, provider peer directory data, population health data. And there's a lot of opportunity there to create actionable insights using AI and ML. And that's kind of where we're focused, is going that last mile of, sales teams can struggle if you just throw data at them. But if you have specific insights that could guide their next steps from a sales perspective, that can obviously translate to a lot of sales conversion. So that's kind of our thesis and where we are, but really cool to see different sides of AI here.
Absolutely.
What I love is that you guys are connected. You're coming out of the redesign portfolio. And you're working with some of the redesign companies. So can you get into a little bit of this redesign? It's really awesome.
And such a great founder community they've created. And it's funny, we have a couple of mutual connections ourselves of other founders. And so this is like a founder community that Redesign's made, and you're helping build founders up. It's an amazing place to start your founder journey. And I know you work extensively with them. So I'd love to hear more about that.
Yeah, no. I definitely a big admirer of Redesign and the venture studio type model. And I've seen a lot of companies come out. So it's exciting to see. And we work with Redesign to support some of the opcos in their go-to-market. And so that's been exciting. And, we want to continue growing with Redesign as a partner.
So as we're here, there's so much going on here at Health. It's just every time I think it's like one more thing. So what are you really excited with this conference that you're seeing?
Yeah, from like a macro perspective, I think I talked a little bit about like the SG&A spend. One of the really difficult things right now is like, how do you look at AI companies? How do you vet them? And so it's interesting to see like big incumbent vendors, smaller startups, and how they're working together. And so I think there's going to be just so much change over the next 3 months, 6 months, 12 months than we've ever seen in digital health. And that's what I'm really excited about is like, the next health is like, what are these companies look like more than anything? And I've already seen involvement, every day as you talk to them. So
Yeah, cool.
Yeah, no, it's interesting. I was at Health last year and then coming to Health again this year. I feel like it's really cool to see all the new startups and the new innovations that are happening. Obviously, we know that digital health was hit pretty hard, post COVID, and especially the venture funding kind of dwindled a little bit. But now it seems like digital health is making a comeback, and that's exciting to see. A lot of tech-enabled services, remote patient monitoring, at-home care. So it's been exciting to go around and see all the companies doing their innovative things.
I love to have founder startups. I mean, you guys are driving, there is no founder without a VC and whatnot and all that. But tell us, for our audience, to those founders out there, I'd love to hear your experience. I know you're kind of new. You've been at it. I'd love to hear more about your experience as founders, both of you.
Yeah. So 10 years ago, I read that book. That's probably everyone's read, The Hard Thing About Hard Things. Horowitz. And I was like, oh man, I know I want to do this. And then the technology really hit where it made a lot of sense for me to do it. We jumped in only a few months ago, but it's been amazing. I think the best thing, what I was kind of alluding to before, is the founder community is I've never had a community that's like builds you up as much. So take the leap is the thing I'd say. And we need more people from healthcare actually building healthcare startups. So like a kind of call to action there would be amazing. So,
yeah, actually, I want to echo that again. I think the founder journey can sometimes be lonely. And so having other founders to support, along the journey, we realized we were both New York based. So there's a good burgeoning New York healthcare founder ecosystem. So it's been cool to see like a lot of founders coming together, supporting each other. And I really definitely appreciate that. But yeah, to Jack's point, I think, the bias for action is something I believe in. It's like when you have an idea, don't wait too long. Try to actually prove it out, build a proof of concept. And I think that's kind of how we approached it. And that's kind of what I would recommend as well.
Yeah. Cool. Well said.
Well, I am knowing that we're going to see some big and great things from the two of you. And, I feel really lucky to stumble there's just so much here and that we're having this conversation. Before we kind of coming towards the end, but I want to come back to generative AI and just sort of where you see that happening, just the big picture over the next year or two. What do you think with that?
I think there's like a lot of excitement.
Yeah.
And it's one of those things where over my career, there's been so much technology like promise, and this one feels real and like actually is working. Yeah. So that's like the most exciting thing. It's like healthcare needs technology that works, and so we're going to see a crazy evolution across those 5 areas I talked about, and that part I'm like extremely excited.
Yeah.
Cool.
Yeah, no, I would second that. I think there's obviously hype cycles, but I think Gen AI has real promise. I think my whole perspective is, it's got to be tailored to use cases. Like I'm a believer in the jobs to be done framework. So what jobs are actually, help, what can Gen AI help automate or relieve folks, So it'll be interesting to see, I think, over the next 5 to 10 years. Within healthcare, there are many workflows that are very cumbersome. How can Gen AI kind of like supplant those workflows in a meaningful way? Yeah.
Is there anything else that we could be needing to just, before we finish on this, anything takeaways?
If you're thinking about becoming a founder, happy to chat. It's an amazing journey. So that would be my last thing.
Definitely the hard things about hard things, right? I love it.
Yeah, second that. I think, I'm always happy to chat with other founders and also learn from other founders, to be honest. Yeah.
That's the best.
So good to have you on. Awesome.
Thank you.